For the sore throats of the world, which are so many and so common in children, when you look at the age groups, the different symptoms change with the age groups as well. And so in little babies, toddlers is going to be drooling. So that's a sign that there's something in their throat that they're not being able to handle their own secretions. So that's one thing that it's a red flag. It could be from a foreign body, it can be from inflammation, it can be from just an infection, or it could even be an abscess. If the baby is drooling and has a low-grade fever, but is able to tolerate fluids and is drinking well, then you're golden, because that tells me that the suck-swallow mechanism, he can swallow, so there's no pain with that, so there's less likely that he has a foreign body, like a coin, the typical nickel or quarter that gets stuck in there. So if they're drinking, that's a good sign. And typically, Dr. Mom will see some little vesicles or little lesions in the throat, and that's very typical of viral stomatitis. And I'll probably say is one of the most common reasons why they bring the child in with fever and drooling. The trick here is Maalox and Benadryl. You do the mixture of equal amounts, and you give the little toddler maybe 1/3 of a teaspoon just to bathe the mouth and the throat. That's after you've already done the saline in the nose and so on. And once you are able to do that, that coats the throat, soothes the throat, and that toddler then will be more willing to take fluids. This is with a typical sore throat, maybe a low-grade fever. Then you can go with popsicles, give them anything to drink, and you don't necessarily need to go to the emergency room. Child gets older, the typical 4-year-old all the way to 15 are mainly the concern is going to be if it's a strep throat or not, and that's nothing that, unless you're having the drooling, the hot voiced potato has been more than 3 or 4 days, that's something that can be seen in the pediatrician's office. So in regards to the throat, that is what you would benefit in your medicine cabinet, as well as throat lozenges for the older kids, so that sandpaper rash feel that they get in the back of the throat can be attenuated, and then that would allow you to go to your pediatrician in the morning. Cough symptoms can be divided into dry or productive cough, and in essence, if you are able to get them to expectorate and move those secretions, it's always better. There's different medications for that, and in general, there's nothing better than actual fluids, water, just to move the secretions. I'm not too keen in being someone that will give you medicines to suppress the cough. The more I practice medicine, the more I realize these natural reflexes and things that our body does is for a reason. So if anything, at night, I will encourage the parents to go ahead and give any of the over-the-counter cough suppressants. But during the day, teach them to cover themselves and move those secretions. The majority of the time, the little ones just really cannot get rid of that loogie, and it gets stuck in there, and then before you know it, a little virus secretion becomes perfect breeding grounds for bacteria, and that's where the pneumonias get in there. So as far as the two medications that you would need in your medicine cabinet would be the expectorants or the suppressants. And within the expectorants, the guaifenesin is the drug of choice that you find in the over-the-counter medications. And in the suppressants would be dextromethorphan. In regards to which syrup is better than any of the others, quite frankly, if you go to your pharmacy and you grab 4 of the different over-the-counter medications, those are the medications that you are going to see. The difference is going to be on the amount that each of them have. And that's what separates one from the other, or if they have Benadryl or diphenhydramine in them, which makes them the nighttime cough medicine, because then the diphenhydramine or the Benadryl will make you sleepy and allow you to sleep a little bit better. So the things to, as mentioned before, to worry about if you were to go to the emergency room would be if you see that the child is having uncomfortable breathing to where now your mother's instinct kicks in and you say, no, that's not right. Like the typical croup that they come in with stridor, that scares anybody, and it can be very scary. But at the same time, all these things that you can do will help you delineate if you can take care of it at home or would need to come into the emergency room.